Hell.
The role of prostaglandins and ergometrine in uterine health. Hey everyone! Welcome back to our channel. Today, we're diving into a fascinating topic that affects millions of women worldwide, the uterus. This incredible organ plays a crucial role in reproduction, and we're going to explore its anatomy, functions, and some common health issues. So, grab a cup of tea, get comfortable, and let's get started. First off, let's talk about what the uterus actually is. The uterus, often referred to as the womb, is a hollow, muscular organ located in the pelvis. It's shaped somewhat like an upside-down pear and is about the size of a fist. The primary function of the uterus is to house and nourish a developing fetus during pregnancy. Now, let's break down the anatomy of the uterus. It consists of three main parts: the fundus, the body, and the cervix. The fundus is the top part, where the fallopian tubes connect. The body is the main part of the uterus, where a fertilized egg can implant and grow. The cervix is the lower part that opens into the vagina. It acts as a gateway, allowing menstrual blood to exit and sperm to enter. Every month, the uterus prepares for a potential pregnancy through a process called the menstrual cycle. This cycle has 4 phases. 1. Menstrual phase. This is when the uterine lining sheds if there's no pregnancy. 2. Follicular phase. Hormones stimulate the growth of follicles in the ovaries, leading to the development of an egg. 3. Ovulation. The mature egg is released from the ovary and travels down the fallopian tube. 4. Luteal phase. If the egg isn't fertilized, hormone levels drop, and the cycle begins again with menstruation. While the uterus is amazing, it can also face some health challenges. Here are a few common issues. Fibroids. These are non-cancerous growths that can develop in the uterine wall. They can cause pain, heavy bleeding, and other symptoms. Endometriosis. This condition occurs when tissue similar to the uterine lining grows outside the uterus, leading to pain and fertility issues. Uterine prolapse. This happens when the pelvic floor muscles weaken, causing the uterus to slip down into the vagina. Next, let's talk about prostaglandins, thromboxanes, and prostacyclin, specifically focusing on their actions in the uterus. We'll also touch on ergometrine and how these compounds relate to conditions like dysmenorrhea and the process of parturition or childbirth. So, let's get started. First off, what are prostaglandins? Well, they are lipid compounds that are derived from fatty acids, and they act as powerful signaling molecules in the body. In the uterus, prostaglandins play several key roles, particularly during menstruation and childbirth. During menstruation, prostaglandins help to regulate the contraction and relaxation of the uterine muscles. They are responsible for the cramping sensations many women experience, known as dysmenorrhea. This happens because prostaglandins cause the uterus to contract, which can lead to pain and discomfort. Now, let's talk about thromboxanes and prostacyclin. Thromboxanes are another type of eicosanoid that promote platelet aggregation and vasoconstriction, while prostacyclin does the opposite. It inhibits platelet aggregation and causes vasodilation. In the context of the uterus, these compounds help regulate blood flow and maintain a healthy uterine environment. This balance is crucial. For example, during pregnancy, prostacyclin levels increase to ensure that the blood vessels supplying the uterus remain open and healthy, allowing for proper fetal development. Now, moving on to parturition, or childbirth. Prostaglandins play a vital role here as well. They help to soften the cervix and stimulate uterine contractions, which are essential for labor to commence. In fact, synthetic prostaglandins are often used in medical settings to induce labor in pregnant women. But what about ergometrine? Also known as ergonovine, this medication is derived from the ergot fungus and is used to manage postpartum hemorrhage. It works by causing strong uterine contractions, helping to reduce bleeding after childbirth. Ergometrine primarily acts on specific receptors in the uterus called prostanoid receptors. These receptors are activated by prostaglandins and are crucial for mediating the effects of these compounds, such as the contraction of the uterine muscles. So, to sum it all up, prostaglandins, thromboxanes, and prostacyclin are essential players in the uterus, influencing everything from menstrual cramps to labor and delivery. And ergometrine is a powerful tool for managing postpartum complications, working through these same prostanoid receptors. Understanding these mechanisms not only sheds light on women's health issues but also informs better treatment options for conditions like dysmenorrhea and complications during childbirth. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more content on health and science. Have questions or topics you want us to cover next? Drop them in the comments below. Thanks for watching, and see you next time.
Pharma Pal.